Right now, fewer than 10% of ICU beds are available in the Bay Area. Across the state, only 1,400 ICU beds are free, and California is averaging about 40,000 new cases every day. KPIX5 reporter Wilson Walker on how hospitals are keeping up.
Yeah, Brian, regional ICU capacity did dip below 8% yesterday. Of course, getting our region out of the current stay-at-home order is going to require turning those numbers around before January 7th. And with the current trends working against our hospitals, that is looking increasingly unlikely.
As of yesterday, there were 3 hospitals with no ICU beds available.
It has now been 2 weeks since ICUs started hitting capacity in Santa Clara County. Since then, hospitals and healthcare systems have been cooperating and hustling to balance patient loads and keep space available for the next arrivals.
There are people in the ICUs who are sort of scheduled to be in the ICUs after major surgery, for instance, and they try and move them out at a certain point in time. So there's an ebb and flow through ICUs.
And those numbers always move a bit on their own. For example, the holidays usually drive an increase in emergency room visits. Our ever-evolving coronavirus trends just get layered on top of all that.
But what you want to see is kind of the overall trend and follow that, because you know, you can always stop doing elective cases, which they haven't asked yet.
Now, that is a change from back in the spring when hospitals did cancel elective surgeries and many outpatient procedures. This time, they're trying to keep all of that going.
And that means that you need nurses and other personnel to staff the operating rooms in the surgical suite. You need more nurses on your general medical floors. And so that limits the number of nurses who are available to work in the ICU or the ED with COVID patients.
That decision has frustrated nurses, now in increasingly short supply.
Hospitals aren't taking that step anymore. They're continuing to do unnecessary procedures, bringing in more and more patients on top of the super sick COVID patients who come in.
So the capacity issue isn't going away, it's still going the wrong direction. Thus the dire warnings about holiday gatherings and travel.
We cannot afford that. We cannot afford another surge on a surge.
Wilson, if we can't afford another surge on the surge, then why have hospitals decided to continue those elective surgeries and outpatient procedures?
Well, any number of reasons, right? Remember back during the spring when they shut down largely, there was a sense that a lot of people were staying away from the hospital that probably should have been there. You know, elective doesn't by any means mean superfluous or entirely unnecessary. These are surgeries that are often, you know, critical to someone's health or long-term well-being. Those were all put on hold. There's a huge demand for them now. People want to get those done. Something else to think about, shutting all of that down cost a lot of hospitals a fortune. So there was a sense that the gears had stopped in the healthcare system, and you've got to keep those moving. Now, as we mentioned yesterday, if there is another surge, yes, you will begin hearing another discussion about how to be more selective about who gets the very valuable space inside these hospitals.
Alrighty, done it good, Sam in San Jose. That's Wilson Walker. Wilson, thank you.